Hi, everyone. Thank you for coming to our talk virtually. I am Lu, a PhD candidate in informatics from University of California, Irvine. I'm very glad to present our work with my co-author team from University of Wollongong, Australia. Our work is entitled To Improve Supportive Care for Patients Taking Oral Anti-Cancer Agents. The work is a collaborative effort with researchers from University of Michigan, University of North Carolina at Chapel Hill, and University of Texas Health Science Center at Houston.
Thank you, Lou. So everyone, as we all know, cancer is a global health challenge that requires continued action. In the last decades, oral anti-cancer agents has been increasingly prescribed to cancer patients due to their convenience, flexibility, and proven efficacy. They may increase the survival rate with lower costs. Adherence is a crucial factor for the success of OA therapy. However, many patients are non-adherent because of the following challenges they faced. First, due to their toxicity, OAA often have complex regimens compared to drugs for other chronic disease with an individualized schedule. For example, it required 2 weeks on and 1 week off. Second, interactions between OA and other drugs or foods may cause intolerable side effects. Therefore, patients using OA have more severe motor disorder and stress. Third, as OA are more likely to be used in patients with metastatic cancer rather than in newly diagnosed cancer patients, their treatment always focuses on relieving symptoms and improving quality of life. In order to address these challenges, innovative approaches are needed to help patients to manage OA-related side effects and to make them adherent to medication regimens and administration. In today's digital age, mobile health has been booming as one of the innovative approaches in healthcare industries. It is the use of mobile and wireless information and communication technologies to deliver medical or healthcare services. It can break the constraints of time, space, cost, and capacity so that provide patients with affordable and ongoing support anytime, anywhere to self-manage their conditions, such as hypertension and diabetes. However, mHealth is not to be fully used to support OA self-management. Therefore, our study aimed to understand different care needs for the patients and their caregivers, as well as their needs for self-management while taking OAA. And leveraging our findings and the characteristics of OAA use in cancer care, we also want to make recommendations to guide the design and the development of mobile health interventions to improve supportive care for patients who take OAA.
For the first research goal, we collected data from Reddit, one of the most popular online communities in the United States. We used OAA names provided by medical experts and collected data posted before March 2021.
So we use grounding theory and semantic analysis to extract the codes and common themes from Reddit's post we collected. We first conducted open coding, discussed and merged codes until no new codes emerged. Then we applied the codes to a random sample of posts. To help theory development, we use an innovative intervention mapping approach based on the OHC findings to help define the mHealth interventions for the supportive care needs of patients taking OAA. We mapped the themes of patients' needs with mHealth intervention techniques and mHealth functions based on a widely used model, care model, also called CCM, to address the challenges of self-management of mobile health. Based on this, we made recommendations on the design and development and of mobile health interventions to support self-management of OAA.
For results, overall, we collected more than 2,000 posts and 3,000 comments. After removing duplicates and posts that have been deleted or archived by community moderators, we randomly selected 300 posts for coding. We coded 64 posts authored by caregivers, 100 posts by patients, and 44 posts by users whose role we were unable to determine. In total, 208 posts were analyzed. We discovered 4 common themes from our data: sharing personal experiences, sharing information and resources related to OAAs, peer emotional support, and coaching. There are 4 sub-themes when users share their personal experiences of OAA use. The first is side effects. Since OAAs commonly result in side effects, patients and caregivers share their personal experiences. For example, in this post, the user shared the side effects that her mother experienced, such as fatigue, nausea, and weight loss. Patients and caregivers are also uncertain about the efficacy of OAAs. Those who took OAAs shared whether and how OAA is able to contribute to their improved health outcomes. For example, in this post, the user shared that her husband was able to benefit from OAA use. Many patients and caregivers also shared how much it costs for them to be on OAA treatments and insurance coverages, as OAA treatments can be financially challenges for disadvantaged families. When sharing personal experiences, patients and caregivers also commonly include personal health conditions, such as cancer types, stages, and previous treatments that they went through. Such information contextualizes their personal experiences, so that patients with similar conditions and at similar stages can use their experiences as a reference. Patients and caregivers also share information and resources that they obtained from external websites, blogs, social media, education pamphlets, their providers, and other patients. Community members shared opportunities that they believe to be useful to others. For example, in this post, the user shared patient assistance programs offered by pharmaceutical companies. The user mentioned that such programs can help financially challenged patients to afford OAA treatments. Patients and caregivers also shared when they had extra OAAs to redistribute to the community. As OAAs have stringent regimens and potential toxicity, patients and caregivers try to understand the mechanisms of OAAs, educating themselves about how OAAs work. For example, in this post, the user shared information about how Xoloda work to clean up cancer cells. As patients and caregivers cope with cancer, they often experience significant emotional disturbances. Therefore, online communities become a place for them to exchange peers' emotional support, such as encouragement, prayers, and comforts. In this post, the cancer survivor encouraged other patients that as long as they adhered to the treatments, they will soon see the improvement to their health conditions. Caregivers who lost their beloved ones also received prayers and comforts from others who have experienced similar loss. More experienced patients and caregivers who have accumulated a wealth of valuable skills and tips of OAA use and cancer management in general shared practical tips to coach others, especially those who just started to use OAAs. The most common type of practical tips is how to cope with OAA side effects, as this is very common among OAA use. For example, in this post, the patient recommended taking sufficient food while taking OAAs because it can mitigate side effects. Patients and caregivers also share tips for communicating with the providers about OAA use. For example, in this post, the patient recommended that they can ask for a specific lab test to evaluate whether a patient will likely suffer from severe side effects of OAA use.
Okay, Thanks, Lou, for sharing the analysis results of the various needs identified from the OHC discussion. So based on these findings, we mapped the elements from chronic condition model to the intervention techniques, and then recommended the function design solutions to achieve different goals of supportive care. So in this table, we can see that for the self-management of OAA, Health can provide patients with easy access to health assessment and healthcare assistance. The health assessment includes a built-in online questionnaire surveys to conduct self-assessment of the side effects of the medications and their psychological condition. Patients can share the assessment results and their experience with their doctors or peers through online chat. This can improve patients' real-time awareness of health conditions and inform healthcare providers to provide patients with assistance, such as symptom management strategies and management adjustment suggestions. Moreover, Health can also provide patients with various forms of educational or motivational materials in forms of tests, videos, web links, and other formats. These resources can be static as functional models, but also can be dynamic, that can be automatically sent to patients as push messages. They can enhance patient ability to self-management of OAA use, thereby to promote their health adherence to the medication. So particularly if the patients have doubts about the efficacy of the medications when suffering from side effects, the information provided by Health may help them understand the characteristics and treatment mechanisms of OAA and active patients the confidence to perform self-management behaviors of OAA use. So in conclusion, our study did a qualitative analysis about patients and caregivers' needs related to OAA use. Our findings identified different care needs they have, such as how to manage side effects, needs for emotional and informational support, as well as financial concerns. Therefore, our study laid the foundation for further Health design and development for OA-related supportive care. So here are the reference list, and we would like to thank the agency for healthcare research and quality to provide fundings for our study. That's all for today's presentation. Thank you for your listening.